Hello and welcome. So, for this part of the session, what we're going to be looking at is defining and understanding trauma. And trauma has a lot of different definitions in different contexts. At a baseline level, what I like to offer is that trauma is not defined by the specific event alone that feels impactful, but it's defined by the event within the context or absence of sufficient care and witness. And I'm realizing something I didn't put on this slide was even like a definition about trauma is an event that pushes somebody outside of their coping skills, right? So it's like an event that is more than you know how to handle and more than you know how to handle with the resources who are available and around you. One of my teachers, Sarah Payton, Sarah loves to read research articles. She just loves it. She eats them up. And I remember once her telling a story about a research article I think she had read between two groups of children from World War II. One group of children who had been separated from and then lost a parent during the course of the war, and another group who had been separated from and then lost a pet that they loved during the course of the war. And the article looked at, like, they took these two cohorts and they looked at the long-term health implications and impacts. And what they found was that the group of children who had lost a pet actually had more severe and negative health consequences than the group of children who had lost a parent, right? And what we can infer from this is that when you lose a parent, people recognize that as an event that is traumatic. They recognize that as an event that requires some degree of support and processing and mourning or acknowledgement. So presumably the children who lost a parent had access to a certain quality of care and a certain quality of resources. Versus when you lose a pet, right, because of the way that our culture is sort of conditioned to not recognize the extreme, just like significance and importance of animals in many people's lives, that for those little people who lost a pet, there just wasn't acknowledgement and wasn't a way to just grieve the tremendous loss that was. So then that grief just stays clogged up in the system and is held and held and held moving forward. So again, trauma is not defined by the event alone, but it's defined by the context of care and witness that are around that person at the time. So if we say that we have these two beings and each of them have an amount of trauma that is in some way, shape, or form comparable, right? In real life, traumas can't be compared. So it's just an example for the sake of this PowerPoint. This person has a very, very small support system. Maybe they have very few resources. Maybe they have to be alone for a long time before the trauma is recognized. And maybe there's just not a lot of people that they can talk to about it. So then if you look inside that, there's really just nowhere for that person to go except away from themselves, right? So this is where dissociation comes in. This is where addictions come in, any sort of like unhealthy coping strategy. Because if we look at that being who has this huge traumatic event that's happened, there's just nowhere to go to escape from the trauma and still feel truly connected to themselves. Versus this one has a huge circle of support. So maybe this one has a lot of loved ones around them, such that, they never really have to worry about being a burden or tiring anybody out talking about the things that they've experienced. Or maybe they have a lot of time to be in processing and a lot of time to heal and to grieve. Or maybe they just have resources where they can go and play, where they can get their mind off of the trauma and they don't have to think about it so much. Then what happens is this person is allowed to move, right? They're allowed to shift and they're allowed to see the trauma from multiple different perspectives and to gain a different lens and sense of what it means. And from this, they then get to integrate that trauma such that that trauma is no longer a defining component or a defining factor of their lives, but it's just a piece of them. It's just a piece of something that was a part of them. And it lives in conjunction with all the other things that also are a part of their lives. So, coming back to this idea of family constellation work and what the purpose is, most lineages have a certain amount of trauma within them. And oftentimes it's trauma that's not talked about, even if we know that it's in the room, right? It can be like the elephant in the room, it just doesn't get discussed. We're never brought into collective spaces to acknowledge it, to grieve it, to witness its impacts. And so, in family constellation work, as we begin to surface those things that are within the lineage and blocking the flow of love, what can happen is as the group is collectively working toward to bringing a sense of witness and warmth and care to that person's history and lineage, is that we come back into right relationship and the flow of love can really resume and be healed. And the traumas that have occurred can integrate as being part of the family lineage and part of the system, but it no longer defines any one person and it no longer defines anybody within the lineage. So we'll invite you again to pause and breathe and notice how you're doing and notice what you need. And maybe we'll also invite folks to get up, get a stretch, go outside. Sometimes these videos are real short, but they can hit real deep. So just give yourself some spaciousness and a break to replenish and nourish yourself as you need to. And thank you.